This study looks at the effectiveness of whole body vibration exercises and core stabilization exercises for chronic nonspecific low back pain versus just a home exercise program. From this, we get information that we can utilize for our own personal programs and also what we can do at home. What did the study look at first? It looked at pain. It gave a VAS or pain scale. It had a pain index, which measures what kind of pain do you have with your activities during the day, at home, with work, how long can you sit for, how long can you drive, those kind of pieces. It measured strength. And then it had a test that measured functional ability and functional recovery. How quickly can you do some things? The three study groups overall was everybody's given a home exercise program to do, but one group also had a vibration component and one had a core exercise in addition to the home program. Who was it? Mostly a middle-aged group. There were 74 individuals overall, about 44 years old plus or minus, and each group had 25 individuals. There were more females than men inside it, and they did this for 3 times a week for a total of 8 weeks, 24 sessions over that time frame. The results were kind of as you expected. Pain decreased overall. We had greater strength and improvement, but the two groups that had the core exercises and then the whole body vibration did even better. Their overall pain, their overall function improved significantly more. And why is that? I think it always comes down to treatment that we see of the better we challenge somebody, the smarter we do it, the better and faster you get. We had very specific training in this with vibration in the core. An even better program would challenge the weak spots specifically for an individual to get that in motion and working as it should, and then challenge through a progression of exercises. And ideally, we make it progressively more difficult over that time period. So over those 8 weeks, we'd have a shifting of, hey, you master this exercise, let's move on to the next. We're always trying to get the system to work better and better together. Now, the whole body vibration group, they had them hold a squat position, a bridge position, and a push-up position. And what they had them do was just hold that for 3 to 5 reps for 30 seconds. So really, it wasn't a very long time. It wasn't a super strenuous activity, but it challenged them. And as I mentioned, this is what the study did, but think if as they got better, we made it even more difficult. And here's a simple squat, push-up, and bridge, 3 to 5 reps for 30 seconds. Now, I think that's good, but we could also make it better. And this is what we do in the office of, hey, you start to master the 2-foot progression. Let's start getting you on 1 foot. Let's start getting you 1 foot with a squat. We can make it more difficult. The more difficult we make it, the more the body has to adapt to that level. We can take a push-up position or a plank position, and then we can start putting you on 1 foot. We can add rubber bands. We can make both unstable underneath your feet and your hands, which is significantly harder. Same thing going from the bridge position. Instead of just being on the bridge with your shoulders on the ground and 2 feet on the vibration plate, if we put you on 1 foot, that exercise is significantly harder than the 2. And if some is good, more is better concept of let's take that activity and let's make it a little harder by putting an unstable exercise ball underneath your neck and shoulders and going from 2 feet once you master that to 1 foot. So the best programs are going to take what this study measured and then make it a little bit harder. It specifically targets your weak spot. It says, okay, you're starting to master this exercise or show progress. Let's challenge you a little bit more so your body has to respond. We can get creative with these exercises. It doesn't have to be standard, hey, this is what they did in the study, we have to do this. We can start adding bands and weights, doing our normal exercise or sport-specific activity on an unstable surface will challenge our core and stabilizers so much more. And once again, we can make every exercise progressively harder through this. The big key, though, is to challenge, not overwhelm. If you do something that's just too hard for your body to master or to even hang on with, you're not going to get any value from it. We want to make it just a little bit harder than what you can currently do so your body can master that, figure out how to do it a little bit better, and improve. So these are all concepts we do on a daily basis in the office. Funny enough, with that study guide, that's the most common low back pain is that middle-aged, getting a little bit older. We can find much more information and treatment ideas, topics, and home strategies on our low back treatment guide that's available on Amazon or in the office. I hope this study provides a little bit of value to you and gives you some ideas of things you can do at home and in the gym.